Thank you. Good morning and good afternoon, since it's in between. I'm going to discuss in this presentation a law that potentially has the ability to increase the risk of HIV infection, a law that is still sitting on our statute books. And the title of my presentation is Using a Feasibility Study as an Advocacy Tool Towards Repealing an Antiquated Law that Perpetuates HIV. And this is a case of the Deceased Brothers Widows Marriage Act. This is a collaborative effort between two organizations, the Share 2 Project, USAID funded, and the Zambia Law Development Commission. And I make this presentation on behalf of those colleagues listed herein. And that's just the outline of my presentation. I come from Zambia, a country in Southern Africa, landlocked, surrounded by 8 neighbors, 13.4 million people, and 60% of the people still live below $1 a day. And like you've heard from previous presentations since we came here, it is within the epicenter of the epidemic with a prevalence of 14.3% in the age group 15 to 49. That's the most reproductive age group. And as you can see, the percentage is slightly higher in women than it is in men. And we work in the area of strengthening, reducing the impact of HIV using multi-sectoral response. And specific to the work in which this research was done, it falls in one of our key objectives, which is strengthening and expanding leadership, involvement in HIV, and improving policy and regulatory environment. Let me quickly get back to the substantive presentation. That, and I quote, is the law that we subjected to critical inquiry. Cap 57 of the laws of Zambia says no marriage heretofore or hereafter contracted between a man and his deceased brother's widow within Zambia or without shall be deemed to have been or shall be void or voidable as a civil contract by reason only of such affinity. In simple terms,
non-legal language, yeah.
This law is saying a man is free to marry the wife of his deceased brother. What then is the problem with this law? Brief background to this law. By the way, we inherited as a country this law from the British in 1926. And we have retained it in our statute books in all the constitutional review commissions. It reverberated very well with our traditional customs. Remember, we have a dual legal system of customary law and statute law. And statute law is actually, customary law is subordinate to statute law. So whatever we do in this area has to be in conformity with statute law says. What then is the problem from a public health point of view? This law is about widow inheritance. Widow inheritance by allowing men to marry their deceased brothers' widows. And we problematized or subjected this law to methodic doubt. We think that this law negates the response against HIV in the Zambia National Response Agenda in the following ways. It increases the risk of and vulnerability, not just for the widow of HIV infection, but the wife of the inheritor and the inheritor himself. Think of it as a triad in which one of the primary actors has got HIV risk. The risk does go to the other two. Number two, we do know that it can impoverish the widow and her children, creating a vicious cycle of vulnerability in the process and creating further risk to HIV infection. The project that I work for is working in 35 of the 288 chiefdoms. And using customary law, most of the traditional leaders and their strategic villages are actually trying to outlaw widow inheritance using customary law. The presence of this law on our statute books, therefore, because customary law is subordinate to statute law, is working as a very big impediment to the transformational and visionary leadership of some of our traditional leaders. We also know that this law does perpetuate gender inequity and inequality. And these in 2009 in my country were recognized as being some of the key drivers of the HIV epidemic during the Prevention Convention. This research was guided by those 4 research questions, the first being to estimate the extent of knowledge among participants regarding this law, and also to determine the relevance of this law in contemporary Zambia, given our socio-economic evolution since we became independent in 1964 to 2014, 50 years down the road. We also wanted to see what risks were inherent in this law and what our society could do after identifying those risks. We therefore set out to collect views from a wide range of participants regarding merits and demerits of this law, with a view to determining the feasibility of either repealing or retaining that law. Methods. We had contacts with more than 3,000 people in 28 chiefdoms, in 26 districts and 8 provinces, and these included chiefs, these are traditional leaders, and village head persons, judges and magistrates, civil society organizations, government officials, and community members. Key informant interviews, focus group discussions, and community discussions were used to collect the data. That is just a pictorial presentation of how the data was collected. Focus group discussions and community discussions. And some of those are our lawyers in the organization that took off their jackets to collect the information. Results. When first confronted with the Deceased Brothers Widows Marriage Act, majority of the people were not actually aware it did exist. They thought inheritance was only being done using customary law. And that is why when they were educated on its provisions, they understood immediately that the intention of the original crafters of the Deceased Brothers Widows Marriage Act were well intended. And this supported at that time, at that time, the social safety net of our society in which the man was the breadwinner. But they quickly went on to say that was no longer the case. Inheritance was perceived as potentially aiding new infections because the level of knowledge is quite high about the sources of infection. Particularly the women who were inherited knew that the introduction of themselves into another union increased the risk of HIV infection, given the reality that only 30% of the adult population in Zambia have ever tested for HIV and know their results, and particularly the men. They confirmed that the Deceased Brothers Widows Marriage Act is an impediment in what the traditional leaders, particularly in chiefdoms where we are working, are trying to do. trying to improve the policy and legal environment at that local level. Other results show that widow inheritance is still an active process in communities, particularly in rural areas. And this is mostly because they don't see any other option. I told you that 60% of the population live below $1 per day, and this is more common in the rural areas where women are still more dependent on their men for survival. Inherited widows reported that lack of economic and social power translated into further disempowerment during subsequent marriages. Sometimes the deceased left some resources which the inheritor wanted to take control over, and they left the woman even more disempowered and the children even more vulnerable to the very HIV infection the inheritor is pretending to protect them from. At the end of the day, the women reported that being inherited is not just degrading, is not only degrading, it's humiliating, it reduces their social standing, their dignity as women and human beings, and it promotes gender inequity and inequality. In response to the big question, what would you want to see? Repealing of this law or retaining of this law? There was a resounding answer in the affirmative. Repeal the law by 85%. And you can see that the traditional leaders who are the custodians of customary law were above the average of 85. They were in the 93% range. In conclusion, while this is more of a qualitative study and limited to areas that we examined, we can conclude comfortably that with a little legal and policy awareness, people have the capacity to identify impediments within the law that govern them, like has been the case with the Deceased Brothers Widows Marriage Act in Zambia. This Deceased Brothers Widows Marriage Act is no longer a protective law that it was. It actually is oppressive against the inherited women. It is gender insensitive. It is dehumanizing and promotes gender inequity and inequality, all of which are catalysts of HIV infection. And with respect to what we found, this law does not have a place to continue its presence in our statute books. As the people have loudly spoken, it must be repealed. Next steps. Working with the Zambia Law Development Commission, which is a government department charged with the responsibility of advancing legal reform, we are gathering more data in order to provide conclusive evidence from across the country in order to repeal this law. In the meantime, we shall embark on strategic advocacy activities with key strategic partners in order to build broader stakeholder consensus and support for the repeal. We are convinced that repealing of this law will work as a catalyst, the much needed catalyst to galvanize the Zambia response agenda, where the policy and regulatory environment will be favorable to both men and women, boys and girls, and so that our women can live in peace without fear of being oppressed. I thank you for listening.